Okay, I am Harald Dreger. I'm president in the International Emergency Management Society, and I live in Norway. And I will chair this webinar today, which is run by Manchester University. And it's about recovery and renewal from COVID-19, a year of the Manchester briefing. Before I introduce the speakers, let me tell a little bit about TEAMS, my organization, the International Emergency Management Society. We were founded in 1993, and we are an international NGO registered in Brussels. So this year we passed 28 years of operation. And we are a global forum for education, training, certification, and policy in emergency and disaster management. We do conferences and workshops worldwide. We have research and development activities, and we have an international certification on emergency and disaster management. And at the present, we also do a webinar on international models in emergency management. Around the world, we have 17 chapters, so we are quite international. And why am I here today is I met Duncan Shaw from, he is doing these briefings, COVID-19 briefings, and he contributed well to our 2 special issues newsletter on COVID-19 around the world. And since then we have been communicated, and teams also distribute the Manchester briefings. And I think it's very important that when we talk about COVID-19, that we have facts and professionals that present these facts. Because COVID-19 has shaken us all, even if it was predicted in several risk analyses, but it seemed we didn't take it very seriously. But we learned a lot now after 1 year of lockdowns, and we are in the 3rd wave, and we don't really know what is going to be the future. But vaccination is on the way, and that will probably be our savior. But also vaccination has some side effects, and I think we have to be honest about that. Teams participated in a project called ASSET. It was about risk communication in pandemics. The background for the project, which was an EU project in the 7th framework, the background was that during the swine flu, WHO said this was going to be a very bad crisis. It didn't happen to be, and therefore people lost confidence in why did WHO say this was bad when it came out to be more a mild flu. And we looked at what is important in communication with the public in a pandemic. And I like to underline one thing which was important. That was to tell the truth to the people and the public, whatever bad it is. And we then focus very much on what we call participatory governance. How can we include the public in the findings and be honest? Just before I came up and started this webinar, I listened to Norwegian news, and you probably have seen that in Norway, we have had some really bad side effects of the AstraZeneca vaccine. Well, I must say they have no proof yet that it comes from the vaccine, but we had 5 serious cases with blood clots, and 3 of these patients died, unfortunately. So the decision in Norway just today, 12 o'clock, was that AstraZeneca is kept on hold until we know more. And I think this is an important thing to communicate to the public that we are honest, so people have trust in what we are doing. What will be the result of this? We don't know. At the moment, it's only Norway and Denmark, as far as I know, that has kept it on hold. It's not banned, but it's kept on hold to see what is the real background. With those opening words, I like to go into what are we doing today. And we have 4 excellent speakers. We have Duncan Shaw, who is a professor of operational research and critical systems Alliance, Manchester Business School. We have Piero Pellisario. He is a chief resilience officer in Milan, Italy. We have Louis Caivahallu, Civil Protection Municipal Service, Amadora in Portugal. And we have Katja Tynan, Manager of Resilience and Disaster Risk Reduction in the city of Vancouver in Canada. We will do it this way. I will soon be finished my introduction, and then we will have all the 4 speakers doing their presentation. They have about 12 minutes each, and I encourage them to keep the time. So we have 20 minutes with questions and answering and the discussion. And I will close the event at 1:30 UK time. A little bit about Duncan Shaw. I won't read the whole, but you will have all this presentation later. But he is a professor at Manchester Business School, and he has been the man behind these COVID-19 briefings, which I found very important, and we included them also in Teams distributions. We also have Piero Pellisario. He is coming from Italy, Milan, and we know that Italy was actually the first European country really hurt by COVID-19. And we really look forward to know how is this going and what kind of issues is important in Italy at the moment. Actually, Norway sent to help Italy. We sent a troop of doctors and nurses to Italy last year to help out. And this year, because we have a 3rd wave in Norway, is that this group that went to Italy last year, they actually come to Oslo, which is a highly red city at the moment, to help in the hospitals in Oslo. We have the next one is Louis Caivahallu. He's a commander of Civil Protection Municipal Service in Amadora in Portugal. And his local point is Amadora. And he has published several scientific papers and reports for UNDRR about disaster risk reduction and resilience in Portugal, and particularly in Amadora. The last speaker is Katja Tynan. She comes from the city of Vancouver, and she's the lead resilience planner and acting chief resilience officer. She oversees the implementation of Resilient Vancouver strategy and works across city departments with external partners to embed and elevate resilience across project planning processes and programs. I won't say more about the speakers. If they feel they will add something which still is on their brief bios, they can, and this will also be available for all of you after the webinar is over. But we need to have some house rules. How do we do this? And we have decided that this webinar is being recorded and streamed live to Facebook. And you as delegates and listening to us have the opportunity to question using the chat function at the bottom of your screen. You click on the chat function, you put your question, and I will later, in order to save time and have time for many questions, I will read the questions, and therefore please say who you direct the question to. And all the chat function will be saved. So if we don't have time to answer all, they can be answered later on. I just tell that I will read the question and post them to those of the speakers it was directed to. And more, there are two different ways of viewing the webinar. If you go to the top right of your screen and hit speaker view, then you will only see the people who are speaking. Alternatively, you can click gallery view, which will enable you to see everyone who is listening and has a camera on. It's however better to watch in speaker's view. This is all the background. I will now just introduce and start the first speaker, and when he is finished, please then the next speaker go on, so I will not intervene between the speakers, and we will keep the time. So please, Duncan, with those words, please give your presentation.
Thank you, Harold. Can I check that you can hear me and that you can see my slides?
You are fine.
Perfect, thank you. So I've been asked to talk a little bit about what the 1 year of Manchester Briefing actually means, and both to look back and to look forward. So look back over what the last year has involved and look forward to what the coming year might involve around COVID and the work that we've been doing for recovery, renewal and resilience. And I think what we can see from COVID is that it's touched every part of our society, every part of our life, really. And the team that we've got working on this really reflects that in the breadth of skills and knowledge that we've been bringing, both currently and previously, to the Manchester Briefing. And so whilst we've got a very broad team working on this, we recognise that we cover probably just a small fraction of the issues that, that we see and that we've experienced over the last year. But on behalf of the whole team, I'd just like to thank Harold and the speakers for coming and helping us launch this, this 1 year of the Manchester Briefing. What has the last year involved for us? Well, we have been doing a lot of work around the UK, and some of the participants on watching it have been absolutely integral to some of that work. We've been working at national level and international level, both through teams, through RCN, working with a whole range of different organisations to try and find the best lessons from across the world and bring those together into the Manchester Briefing. So the briefing now goes out to at least 52,000 people, I think we've stopped counting, through a whole series of partners, about 20 partners in all. And we disseminate it very broadly to try and help government to think through what are the challenges that they're experiencing. So we are almost 1 year into the Manchester Briefing project. We have issued 32 briefings, and Jen Bealt and Roisin Jordan have been absolutely instrumental in keeping us on track with those briefings and keeping the content flowing so well. But we have amassed lessons from over 93 countries and brought them together to try and inform the community on what is going on out there. And we're absolutely delighted that we've been funded to support and continue this work over the next year, and are turning these lessons into what we call the international standard 22393, which is bringing together all of the lessons on recovery and renewal and what does that mean for our communities. So to give you some examples of lessons from the Manchester Briefing, we cluster them around 6 core topics, and stretching to all parts of the world, as I've explained. And Piero is going to talk about some of the environmental work that he's been doing in Italy, and some of the ways that they have been talking about bike lanes, and they're thinking about planting trees and all of sorts of things like that. And we can see similar examples of those sort of climate change environmental tasks being done in all countries. And I think across all of the 6 topics, we see a huge similarity in the sorts of recovery and renewal actions that are being implemented and that will be implemented over the coming months and years as we begin to deal with the aftermath and the impacts and consequences of COVID. We obviously are expecting some significant economic issues to arise, and those have already been felt very presently in a number of countries, but that's obviously going to continue as different government mechanisms come to an end, as those mechanisms have even they bring even stronger effects into our communities, and we start seeing some of the real challenges happening there. And we've just been talking with the chief exec of a local authority, and he's saying that, you know, as unemployment begins to rise, that's going to put stresses on our housing sector, that's going to put stresses on the mortgage sector, and really we can see that COVID is having touch points across every part of our society. And why is this? Well, it's really because the scale of this is absolutely unimaginable previous to our experiences of this year. The constant move between response and recovery in the UK, at least, has meant that the recovery from COVID has been extremely difficult. We have had an addictive pace to response, which meant that we've been in emergency response for a year, and carrying that through into recovery is a real danger. We need to take an opportunity to pause and to reflect, and then to move into recovery and renewal. And all whilst realizing that recovery will happen locally, but that national has a very strong impression and strong understanding as to what needs to happen across our countries. Recovery is going to be made more difficult because of some of the disconnects that we've seen during COVID. And those disconnects are both within the guidelines that we've experienced, the politics and how they have played out at the local level, and the systematic sharing of information across the different layers of government, which has meant that the response has been difficult, but also that recovery is going to be challenging as well because of getting different systems to talk to each other. We've seen fragilities in our system that we knew existed, but we had never seen as vividly before. So the vulnerability, the inequalities that we've seen, really the failure of ourselves to try and imagine what this was going to be. So if I'd said to you a year ago that we are going to be in the situation that we're in, then I think that our imagination would not have allowed us to realize that that was even a possibility, never mind the reality. And recovery is going to be made more difficult by the change that we've experienced over the last year. We have had multiple relationships have developed, and some of those have been incredibly productive. Some of the relationships that we thought were strong have proven not to be as strong as we'd hoped. And every time we think we've got a grasp on response or recovery, there is another curveball that the virus throws at us. And that ever-changing complexity has meant that we have some unique opportunities for change in our country. Change around recovery. And by recovery, we mean the relatively putting things back together, re-establishing preparedness, getting our systems back up and running again. And we've got huge opportunities to co-produce recovery. And Harold said about participatory governance. And this is really what we're talking about when we think about how can we ensure local democracy takes its role in recovery and renewal. I've mentioned the need for pause, and that's really a need for healing and for a review, to recognise, to memorialise, to remember, and take an opportunity to share the global learning that we've got and share that for the good of what's happened. And obviously the briefing is just one way of doing that, but certainly not the only way. We see that renewal has certain opportunities. So by renewal, we mean these huge, significant changes that we can make to our society, all for good and positive ambitions for change. And in the UK, we can see that we can integrate health planning and resilience much better than it's been in the past. We can see that some of the inequalities that we didn't quite know were there, but we can begin to address these. We can more vividly understand what those are. But we need to balance renewal with new ways of working. We've got global political pressures, we've got fiscal pressures, and sort of balancing the renewal with those pressures is going to be incredibly important. But nevertheless, it offers another opportunity. And as the title of the presentation suggested, all of recovery and renewal is going towards building a better, more resilient society. And here it's about understanding how risk and resilience can be supported by partnerships, these new partnerships that we've got, by acknowledging that these new resilience capability of our community resilience exists, and think about new foundations and new ways of working. So I'm not going to go through this slide, but what I would like to do is talk a little bit about what those impacts of COVID have been. And I refer to one of our key partners in this project, Essex Local Resilience Forum, and thinking about some of the work that they've done to understand where the impacts of COVID have been. And if we just look down this list, we can see that it has touched, again, every part of our society. And so whether it's the health of the population, whether it's children, young people, whether it's our transport system, our economy, the environment, crime and community safety, there are huge opportunities across all different aspects. And so one of the challenges then is to think about, if we can understand these different impacts, now what are we going to do about them? And so recovery is about using some of these impacts potentially as a commissioning tool. So how do we support vulnerable adults differently? What services do we need to commission to provide support to them? The voluntary sector might be one of those bodies that we could commission to support them. But what sort of activities do we need to commission in order to provide that support? And so recovery is all around for us thinking about what those more transactional activities are, and then what do we do about them as a result? In contrast, we've got renewal. And renewal for us, as I said, are these big strategic opportunities. And here we've been talking about local renewal summits. And it's perhaps too early in the UK to start thinking about renewal summits because of where we are still just coming out of response in a national lockdown. But here we can see that renewal needs to be underpinned by optimism. We need to be bringing together the strong representation of our communities and bring them together in a summit to talk about what are the opportunities that we want to exploit. I also said I would talk about what the next year looks like, and here we've got just some of the partners that we're going to be working with to understand what they're doing through recovery renewal to build resilience. And I'm absolutely delighted that Katia is going to be talking a little bit later about the work that Vancouver has done, and just like to thank Katia for getting up so early in the morning to do that presentation. But we've got really an excellent set of different partners to try and understand what's going on in different parts of the country. And just my last slide is looking at the sorts of recovery that we're going to be analysing as part of the next year of the Manchester briefing. We'll be looking at all of these issues through the team that I mentioned at the very beginning, and bringing together the collective expertise of our partners and the team to try and understand what's going on in different parts of our businesses, our societies, our tourist economies, our communities, to understand where recovery has existed and understand some of the frameworks for that. So I'd just like to thank you very much for listening. Thank you for signing up for the briefing. If you don't already get the briefing, then the URL is on the slide. And I think Harold asked me to hand over to the next speaker. So I would just, I will stop sharing my screen and just thank you very much indeed for listening. Thank you.
Piero, you are on. Are you ready?
Yes, I'm here. Okay, I go. Good morning, good afternoon, actually. Good afternoon, everyone. Let me share my screen. Hopefully, it's now. Well, let's say it's full screen or still not.
It's no, I don't think it's full screen yet, Piero. No.
Okay, I will do it. Maybe now, yes.
Perfect.
Yeah.
Perfect.
Okay. Oh, sorry. Thank you very much for your kind invitation. And it seems it's a long time. It was 1 year ago when we got into this pandemic and this emergency. It was at the beginning of was February going through, and then March we go for the lockdown, and we started a conversation with all the city is part of the Resilient Cities Network, and in particular with Manchester, we got a really close conversation. We were going to get to understanding how to deal with this through the time. But since the beginning, since March, we always start also thinking about what should be the next after the lockdown, how will be the city will wake up, and how we should recovery even our economy, our social relation, our investment after it. So in April 2020, the city, since the beginning, actually, also my team were focused on the adaptation and recovery strategy of the city. So in April 2020, the city launched this participatory process to get from the communities what were the ideas of what should be the city next after the lockdown. And we go through all the contribution between April and May. We got debates, and the document revision was June, and we got a huge amount of proposal for all our community. And then we go through July. Then there was the Commission has adopted, the European Commission has adopted the Next Generation EU, and is including two line of funding, the Recovery and Resilience Facility Fund and the REACT-EU. In September was approved the Next Generation EU by the European Commission, and then since September, the national government, international government started to give us indication guidelines to how we should design and prepare us for proposing action and investment for the recovery. And we got in January when we got the first draft of the Italian recovery plan, and now there is April deadline when we need to submit to the Commission our national plan. But before April, we are still in March, and we are back in the lockdown, because then is one of the points we're still there. We got a vaccine plan in place that maybe is going slowly or what we are expecting, but we are performing, we should performing better. But at the same time, our community is still locked in their house, and school is still from distance, and we need to really push more now for the new phase. So when we look at the strategy and the action of our adaptation strategy, what was at the beginning, was April and May, as I said last year, we start looking at the different policy. We look at the reach and timing, so how we can maximize and the flexibility of the time of the city. We look at the mobility, how to reduce the movement and diversify the mobility supply, so what should be the different option we can guarantee to people. We look at the public space and the well-being. The public space, because we already understanding that the social distance, or the better name, like the physical distance, was necessary to guarantee a more safety, but at the same time, when we look at the well-being, there is something pretty clear comes out after this pandemic. Then even if there is not a proof correlation between the air pollution and the COVID, it's pretty clear that a population that is already exposed to health and respiratory disease because they are living in polluted areas, they become more vulnerable even to a kind of virus as is the COVID-19. And Milan is one of these spaces. So for us, work in the public space nowadays is not even an option. It's a necessary action to take in, because we need to recover and to guarantee a better future, a healthy future for our community. Then we work on the digital services. So we need to look at the expansion and the ease of the access to the digital services, because that could help us to get more close to our communities in terms of offering, instead to get to the office and so on. We look at the services in the neighboring. So we already start thinking about the 15-minute cities concept. We start looking how we can better develop the 15 minutes walking cities. And this is linked to the public space, digital services, and mobility. Then we look at the culture, so how we can improve the spread of the culture, how we can guarantee a better offer. Milan, as the other cities in Europe, they were known as an entertainment economy, and this is based also on the culture that we have here. Economic activities, we need to look how we should push for innovation, but always thinking about inclusion, because they're strictly connected, these two elements. We look at infrastructures, housing and public works, how we can simplify the procedure to speed up the economy, especially in the real estate, how we can then guarantee the continuous growth and retrofitting, also because the national government have put in place challenging policies and initiative schemes that is really challenging for the energy efficiency and retrofitting the building as one of the key measures. Then we look at collaboration and assistance, so how we can recover the collaboration spirit within the city. And then here, what we got from the proposal, from the communities, we got almost 3,000 proposals submitted by the city of Milan. And if you look on the left side and on the map, the majority of this proposal, we're looking at pedestrian spaces, how we can increase the street to pedestrianize, at the same time, how we should enlarge the zone 30, the 30 kilometers per hour, so the limit to reduce the speed of the cars in the city. They were proposing us to increase the bike lanes and the bike sharing in the different offers. Then they were asking us to improve the quality of the public transport. And they were also start thinking, the communities, what could be the next phase? So not only after the first lockdown, but the recovery. So one of the major proposals was the reopening of the canal or the Navigli as one of the elements we need to look at this. Then there was the urban green, and see how we should improve in the green space and the green spot. All this proposal comes and actually confirm what the city were already doing, because in the emergency world, as you better than me, when an emergency comes, it's important what you do when an emergency comes, but even more important what you have done before the emergency. And we've taken this kind of opportunity to speed up and to scaling some of the action we're already implementing as a recovery action and to guarantee the essential needs and services for the people. So we start looking at the timing and the risk. All the major cities in Italy are obliged to define, in Italian is named the piano dei tempi degli orari, so it's the time plan of the city. And we start looking at the school, how we should reschedule the entrance and the closing of the different activities in the city, from school, university, and commercial activities. But at the same time, we also extend the time of entrance for the public servant in the office to make less congestion in the public transport. We were sitting with the private companies and with the banking and financial and insurance services to negotiate with them and to understand which is the best balancing between the people in the office and the people in the smart working at this time. And then it was a challenging initiative, but this has become one of the key also policy for the future, because we have understand a better quality of conversation and dialogue and with the all different stakeholders. We start working on the Strade Aperte project. The Strade Aperte is the open street program, is to extend the bike lines. We don't have the number, maybe that other cities as Paris and Barcelona have done. Paris has an incredible number, but Milan is a really small city, 181 square kilometers, and we were capable, we promised was made to create 50 kilometers of new bike lines before the end of the years, and we got more. We got 61.7, and we are now planning to reach 111 kilometers of new bike lines, creating on as a recovery, as an action. And here we got an interesting step like this. This is helping us also to rethinking the sidewalks or to temporary pedestrianization in the neighborhoods. And now we are working, for example, on the play street. So how we can temporarily close some street to enlarge the public space for pupils to play on the street. Then we work on the Piazza Aperte project. The tactical urbanism program was already in place thanks to the collaboration of the city with the Bloomberg Associate, with the National Association of City Transportation Official and the Global Design Cities Initiative. There was, at the beginning in 2018, there was only few space. This space were before used and occupied by cars, so not by the people. And we're inventing these spaces, introducing the benches, potted plants, bicycle station, and tables in ping pong. For example, the 20 ping pong. We also have a tournament over the summer of ping pong all over the city, because that give us the opportunity to enlarge and to guarantee more public space for people, but also restart rethinking what is necessary for the future. So we put the people at the center of the urban planning procedure. And here, again, is also a way how we can improve the ecological transition of the cities. Because if you measure a cars park on a street, on a square over July, it could also reach 80 kilometers. So also in a time of climate change, because this crisis is never ended, this is help us also to face one of the major risks also for the city, that is climate change. Then we work to guarantee more outside spaces for commercial activities and bars. We receive more than 2,000 request for the people. It was July 2020 for the activity, from the activities. And then we keep going even after. We're supposed to end in October, but we decided to keep in the longer term and to take it until July 2021. And then also seems that people are now asking that we should keep it as it is even in the future, because the people start to enjoy a different way of the city and the street when there is more people and less car around. Then we look on the collaboration and assistance. We have a 3 different kind of fund that was the mutual aid fund. With the mutual aid fund, we have supporting economic activities, but as well, we also have support some of the initiative. We have launched a couple of initiatives. One, it was a civic crowdfunding. There was coupling resources from the EU structural fund and the mutual aid fund, and coupling with the crowdfunding initiative to promoting new social activities and new economic activities in the cities over the autumn. And we already invest 5 million euros on this, and we're creating new company. We work on the food aid system. The food aid system, we have a great collaboration with the Red Cross, with the Caritas, and with the religion, non-religious association. This is where, thanks to the food policy we launched in 2015, but that gave us to create permanent hub to distribute food to the vulnerable population. And we create 10 new hubs for the city. That was capable to reach more than 20,000 people and 6,000 families in need, reach out with the 616 tons of food in the 15 weeks. And that was an important step for us. Then we got Milano Aiuta, and Milano Aiuta is expressing what is the feeling of the communities of Milano. Milano is based on a community that love to help the others, they love to be part of the process. So we work with them to create a bottom-up approach, even in a time of really critical situation for all of us. But then comes, after this adaptation time, it comes an opportunity for the recovery. And the recovery comes thanks to the European Union that give us this frame, that give us 2 major opportunities. One is an investment plan, and the second give us with the next generation an opportunity to an important reform of all our policy and administrative. So the next generation EU is based on 2 main pillars. One is the recovery and resilience facility, that is almost 672.5 billion euro, and the REACT-EU, that is the recovery assistance for cohesion in the territory of Europe, is 47 billion euro. And the recovery and resilience facility in the REACT-EU has to be strictly connected to what you already have designed and put in place, because you have a short term to spend all this money. It is until the end of 2026. So for us, and the City Resilience Department was part of the support team to the city manager, together with the environmental transition approach. They have to identify 3 main pillars: was equity, digital transition, environmental transition. Because our output want to create a cross-cutting, inclusive, and integrated comprehensive proposal for the Milan municipality. But then it's also important here to say that the digital transition and environmental transition was not something new for us. Because it was something that we already put in place, and we already mainstreamed this concept over the last 2 years, in 2018, 2019, before the COVID, with the other department to make this a cohesion. So what is coming out, it's a work created by the orchestra, the Milan Public Servant Orchestra. We're creating an important plan, an important recovery plan, and it's we identify 6 topics for the long-term: sustainable mobility, environmental transition, social inclusion, school, culture, and digital. And we want to create school, put school at the head as the public space of this concept, because school is one of the main, and our purpose is for them. This recovery and resilience plan, more than for us, is for the future and for the next generation. So it's for the purpose. So school has to play an important role for this. And the left side, you see, which is the recovery and resilience facility. On the right side, that is the first funding we get now. So it's the REACT-EU, has maybe got more in the details what we are looking at the moment. So with the REACT-EU, we are going to ask more money to scalability and smart mobility. We work on the circular economy to create. We already are one of the leading cities in waste management, but we want to improve the capacity of the reuse, what was called before waste, now it's second-hand materials for us, and improving. So we're working on a new district for the circular economy. We work on social inclusion, but also supporting sport activities, because we also have another goals in 2026. We are the organizer of the Winter Olympics game together with Cortina. So we're in the next 5 years, we have to spend the Recovery and Resilience Funding, but at the same time, we have to organize the Olympics game. Then we have green energy and smart building, that is always at the head of our plan. And then we got the urban regeneration investment we want to create, but not only thinking about the big development, but looking also at the small intervention as the Piazza, the open square, that create a new sense of appartenance of the community in rethinking our city. So all these kind of elements for us are the key element that will drive to create a more equal society, but at the same time to not going to the same situation. So we need to use this money as a prevention and precautionary measures, not for climate only, and not only for sustainability, but more and more to have a healthy and well-being cities, to avoid it. Our community will suffer again what we have lived over the last years, and we are still living on this. Thank you very much for the invitation.
Louis, are you ready?
Yes, Harold, I'm ready. I'm just sharing the screen. Can you hear me and see perfectly, correct?
Looks good.
Okay, thank you. So first, many thanks for the invitation to be part of this. I will speak a little bit about our experience about the COVID response and recovery at local level, specifically in Amadora. I will start just to show the Amadora position. Amadora is a small municipality in the Lisbon district. The population, we have almost 200,000 inhabitants. Amadora has the highest population density in the country, more than 7,000 inhabitants per square kilometer. And in relating with the social problems, we have, for example, almost 4% population living in slums. So this is the thing that we are trying to solve the next decade, that we have many people living yet in slums. We have 10% people from outside, people from ex-colonies of Portugal, and almost 20% of the people that we have in Amadora has more than 65 years old. So this is our, very briefly, our picture about Amadora and their position. About the COVID impact, as you know, in March of 2020, we start have the first case at local level. We had, looking for 1 year of the COVID pandemic situation in our country, and specifically in Amadora, we had 3 waves. So the first one was in March and April of 2020. And after that, in the end of the year, after the opening of the schools, we had another wave, the second wave. And recently in January and February, after the Christmas season, we had a big wave, the last one that show us that almost 400 cases per day in Amadora. So it's too much for a small municipality as Amadora. So looking this and compare this statistic with our numbers in the population, we had more than 17,000 infections in our municipality. That represents almost 10%. We had more than 300 deaths for COVID, but we have many people recovered from the virus. That represents almost 9%. So looking back, looking for 1 year of COVID, we had for all the country a 14th state of emergency declared by the national government. We have 2 statements for disaster status and 1 contingency status declarations for all country, and that means that Amadora is on these statements and declarations about the emergency for 1 year of COVID. Well, looking for the response, mainly on the last wave that we had a lot of problems just to respond. This one example, Amador has a public hospital. We have to move during the third wave, and in February we have to move some patients from the public hospital for the other private hospitals because we have a lot of pressure here, and we have to just evacuate some patients of the COVID-19 to other hospitals. So, and the collaboration with public and private hospitals works very well at national and local level. So that's one example of the impact of the capacity to respond actively. Well, since when the virus came in the last year, just we created a specific structure just to respond. We established an operational center for COVID-19, leading by the mayor, of course, because the mayor is the civil protection authority just to lead this kind of process. We have the municipal emergency plan activated since March of the last year. And the operational center has just two sectors. We have a sector that are connected, but we have two sectors. One sector with security, with representatives from the local police and national police. The rescue sector with the fire department, the Red Cross, and health and local authority in the public and other public hospitals. So the objective was just to have the people, the representatives on the same space just to deliver the needs and to establish the priorities. The other sector, the sector B, is about the logistics. So we had a lot of pressure just to have all the equipment, all the teams on the ground. So it was very important just to have a team specifically for the logistics and for the social. So we have the social impacts was huge in Amadora. So it was very important just to have in this sector representatives from the social department in Amadora, people from the Red Cross and the Social National Institute. So this center was like the heads of the response and the recovery of the COVID at local level. So the mission, as I told you, was just to have daily briefings on these operational centers, just to identify priorities, gaps, needs, and just information sharing. So very, very important to have this interaction between all the sectors and representatives. Looking for the response the last year, we have just some numbers just to understand the impact of the pandemic situation at local level. We spent 3 million euros for COVID equipment. So because, for example, Amador provides some equipment, so for the representatives of the police, the fire department, for the local health authorities. So we spend a lot of money for this kind of equipments. We spent 2 million to support local economy. So we have 3 lockdowns, 3 waves, 3 lockdowns, and the economy, as we know, was very and strongly affected. We developed 2 social programs specific to the schools and the vulnerable groups. And during 1 year, we did a lot of tests, and we have more than 75,000 tests for COVID-19. So just some pictures to show you the importance of, for example, the meetings that we have. This is an example where the Prime Minister came to Amadora the last summer during one briefing just to understand, to debate, to create discussion about the rules and the measures that we are where we put on the ground, and some pictures about our work on the field. So this work with the population during the lockdowns was very useful just to have the strategy about the response and the recovery process. About the recovery, the national government presents the one plan just to recover. This plan was presented 2 weeks ago and had just 5 big priorities. So the plan presents some guidelines for the local implementation. So Amadora has to follow this plan, and the plan has 5 big points. The first one is important to have a mass testing of the population. The second one is try just to vaccinate as soon as possible all the segments of the community. The third point is support economy. Fourth, social programs to support families, very, very important. And the fifth, I think is normal, is trying to just restoring the community normality in some sectors. For example, we start after the third wave with the schools. So we just, for example, at national level, we just have opened the schools, and the second phase will be trying to open the commerce after in the first week of April. Well, what's going on in Amadora since the plan was presented by Prime Minister 2 weeks ago? So we are right now testing, trying to test much as we can. We have 6,000 tests per day for the school staff, municipal service, security and rescue service. So this is our focus right now, to guarantee reopening of the activities at local level. We are doing a vaccination for the specific groups. For example, elderly groups are priority for this. We have more than 12,000 people vaccinated, so that represents just 6.6 of Amador population. It's a very few number of people of vaccinated. We have a budget that will be available to the local commerce with 4 million euros just to support during this year the local economy. And now we have a huge and strong focus on social programs to support families. We have many programs just to try to understand if people need just food, medicines, psychological support and domestic violence. So we have a lot of cases that came with the COVID-19 pandemic situation about domestic violence. So we have a big increase of this kind of situation. And well, the restoring normality with, I think, came with if you guarantee testing and vaccination as soon as possible. So finally, I bring just, this is an example about the COVID test for school staff that's working right now. So what was the lessons learned and what could be the next steps? I think we learn with 1 year of the COVID-19 at local level. So I think the distress that we identify is the difficulty in monitoring and compliant COVID measure. It was very difficult just to, we had a lot of legislation to apply with COVID, so it was very difficult to monitoring this in the field. The second point was the sharing information between entities, the health, rescue, security, social, geographic information. It was very hard because each entity have the own databases. So we don't have, for example, a common database just to manage the information. The third is about the acquisition of COVID equipment. The other things was about the physical and mental tiredness of all the local COVID teams. The intervention strategy with constant change was very hard for us because it was very, very difficult for us to understand the evolution of the pandemic in Portugal, and specifically at local level. We felt that, for example, we never test a pandemic scenario. Looking back the 10 years in civil protection, we never test the pandemic scenario. We never had a drill about this. So it was very hard just to organize a specific response for that. We found the lack of sufficient resources to manage all the things that we had. And right now we feel the strangulation of the operational response to other type of disaster. What was the gains? I think the good cooperation between the political, operation and technical level, I think was a very interesting gain that we found with the COVID-19. Good ability to react to adversities. The local stakeholder network, we have a good stakeholder network, was essential just to deliver strategies. And we felt that we established a resiliency mentality in all actors of the economy. And I think this was very useful just to the next months and the recovery process that we have had in Amador, I think in all the country. So this is my notes about our experience in the local level. So thank you very much for your attention and invitation.
Katja, are you ready?
I am ready.
please.
Can folks see my slides?
Yeah, in full screen mode.
Okay, just a moment.
Beautiful picture.
Thank you. There we go. Full screen mode.
Good.
Okay, thank you so much for having me here today. It's a pleasure to be able to hear these other speakers and the incredible work that's happening in their cities. I am going to speak a bit about what's happened in Vancouver over the past year. For those of you who don't know, Vancouver is a coastal city that's nestled on the southwest kind of corner of Canada in British Columbia. We have a population of about 650,000 people, and we are part of a metro region that is a couple million people. So we're not a particularly large city, but we have a very, very dense population, and there's constantly a kind of tension and demand on our infrastructure and our resources because we're so dense and so small. So we had our first COVID case in the Vancouver region on January 28th of 2020. By March 9th of 2020, we activated our Emergency Operations Center, and that is still operating now. At this point in time, we have seen provincially about 1,400 deaths in the province, which may seem like a small number compared to some of the other cities, but again, for our not particularly large population, this has been significant. We are also seeing a third wave happening now here. As of yesterday, we had 800 new people diagnosed with COVID just from yesterday alone. And our average over the last week has been about 700 people per day. So response is very much still underway in our city. In March, when the virus first struck and our operations center first was stood up, the province, which is the lead agency here on pandemic response, implemented physical distancing and closure of facilities that were considered to be non-essential, as well as required enhanced hygiene protocols in any facilities that were still operating. Now, while this was all meant to slow the transmission of the virus and was very effective at that in the early days, what was realized very early on was that by closing many of these facilities, we were actually creating kind of secondary emergencies in our cities or in our city because people lost access to the services that they relied on. So our Emergency Operations Center and our response was focused on kind of two different streams of work. One was on slowing the transmission of the virus, and the other was on mitigating the impacts of the closures and the health orders that were being implemented. What this looked like on the ground was that, for example, the closure of facilities meant many free and low-cost meal programs that serve low-income families and individuals had shut down. And so the city worked with community partners to be able to produce meal hampers for low-income families, as well as pay catering companies and social enterprises to deliver meals to people who are living in chronic poverty. One of the actions that we took in this area, recognizing the rise of anti-Asian violence in our city and around the world, was that we developed a program delivering culturally appropriate meals to Chinese seniors living in Chinatown in Vancouver so that they wouldn't have to venture outside if they didn't want to. Another issue that struck up for us around this was the closure of community centers and library facilities, which homeless people in our city rely on in order to use washrooms, to wash their hands, to access drinking water, and to access Wi-Fi and use computers for digital services. So the closure of community centers and libraries resulted in these people no longer having access to hygiene facilities as well as digital services that they required. So again, much of our response was on mitigating these issues, on standing up washroom trailers and paying peers in community to be able to staff them. As well as working with telecom partners to try and get used cell phones that we could then put prepaid data plans on and give to community members. That's what response has looked like. And again, this is still ongoing. But in May of last year, we stood up our recovery planning team. So this was formed of a bunch of different departments at the city with a centralized city manager's office who was coordinating this effort. The timeline that was set out at the outset of this work was quite tight. So the decision was made to do recovery work over the next 6 months and come back to our city council in 6 months, so November of last year, with a recovery plan in place. Not necessarily to have finished the actions that we had identified, but to at least come up with the plan and the actions that we would be doing. That's a very short planning timeline. And I will say it was especially challenging because many staff members, sort of at the coordination level, at the research level, who were tasked with working on recovery, were also working on response. So they were simultaneously juggling these two theoretically different processes. But what that resulted in was a lot of overlap in terms of the actions that we were putting forward in both of these strategies and plans. In addition to that, there were 7 recovery streams that we had. So this ranged from business supports to nonprofit organization recovery, to recovery for vulnerable or disproportionately impacted people, all the way through to identifying ways to streamline our permitting process. So I've heard from all of our speakers today that that's something that's been happening in a lot of cities as we're expanding bike lanes. We've been putting temporary patios and plazas out. And Vancouver, it's very much been the same story as we've been looking to our outdoor spaces as a way to allow people to get access to recreation, as well as to be able to connect with each other in safe ways outside. So all of these recovery streams have done phenomenal work, but one of the challenges that I think we've really faced in this is the lack of kind of a meta recovery strategy. So each of these streams sort of had their own recovery planning process, their own methodology, their own engagement and communication, and some of them had their own impact and needs assessments, which was important, but we didn't actually have an overarching one that enabled us to make sure we were covering kind of all of the different dimensions and spheres that we needed to cover for recovery. So those are some of the kind of key challenges that we saw in that work over the last year. We reported back to council with our recovery plan in November, and since then, all of the teams have been working really diligently to implement those actions. Many of them have been implemented. Some of them are ongoing. We have another report back to our council on this work come mid-April, so in a couple of weeks, where we're going to kind of give them, again, kind of an update on how many recovery actions have been completed. One of the concerns I think we have around this is the fact that the pandemic is still raging in our city. You know, again, I mentioned just yesterday, there were 800 more cases. There are 300 people currently hospitalized. We're still seeing our death toll kind of move up. So the concern is that while recovery work will continue, the planning process has somewhat closed for the pandemic, at least for the time being. And I think, you know, Duncan said this really wonderfully at the beginning of this session, that there is a need for us to kind of pause and reflect about recovery as we move forward so that we can get to not only integrating the lessons that we've learned over the course of the pandemic and integrating them into our long-term strategic planning, but also a need for us to kind of pause and reflect so we can actually understand the full breadth of the impacts that have been experienced in our community. And so my hope is that as the pandemic actually eventually winds down, we are seeing vaccine rollout in Vancouver, but as the pandemic winds down, my hope is that we are able to restart this process and in particular focus on economic stimulus. That's something that we don't or we haven't been able to leverage significantly to date. As well as to look at the way that we might need to support our community and work as a government agency to help community actually kind of grapple with the mental health implications of the last year. Now, in terms of some general lessons learned, I think for us in Vancouver, and I imagine for many other cities too, We have a team of staff in our city who are experts in disasters, but this was just different from anything that we had previously planned for. We did have a pandemic response plan in place, but I think some of the learnings around the limitations of resources that we could draw from during the pandemic was hit us pretty hard. So, you know, in any other localized disaster like an earthquake or a flood or a fire, we would be able to draw significant support from our senior levels of government in order to respond and recover from an event. And in fact, our senior levels of government require municipalities in Canada to have a recovery plan in place before they will actually give out stimulus funding. So there's major incentive for us to create recovery plans fairly quickly. But in this case, every city all around the world, as you know, is dealing with the pandemic. And so our senior levels of government didn't actually have the funding that we might normally lean on to be able to support our actions. In addition to that, one of the lessons that I really hope that we internalize as an organization and as a community is how to deal with these protracted emergencies. And in particular, I'm thinking of this as a lesson for how we're going to have to manage climate change over the long term. So again, as an ongoing crisis that is going to have peaks as we go. And a key piece of that, I think, is working critically on mental health, empathy, and hope. I think one of the most severe impacts across all demographics in Vancouver has been the mental health implications of the past year. Physical distancing, quarantining, all of these things. People are social animals, and being indoors all the time, especially in a city that prides itself on our outdoor recreation and socialization, has been incredibly challenging. And then last but certainly not least, again, with many other disasters, we would see physical impacts to buildings and infrastructure. And so the fact that we haven't had those, and yet we are still dealing with a crisis, I think has really daylighted how critical socioeconomic equity is. So we live in a city where there are ongoing stresses of chronic poverty, of social isolation, of homelessness. And I think this crisis, more than any other that we faced in the past, has really highlighted for not only our political leadership, but also our entire community, the need for us to equally invest, not just in our buildings and infrastructure and our built environment, but also invest in the systems that build equity and enable people to thrive day to day. So a couple of additional learnings that are maybe a bit more specific to Vancouver. In terms of our recovery work, I think this has been a really great lesson that there is a need for us to have an overarching cohesive approach to recovery. So centralizing things like communication and engagement across recovery teams, breaking down the silos of our recovery streams so that we can do holistic integrated planning, looking more closely at our processes, our decision-making frameworks to make sure that the right people are at the table to be making choices about how we prioritize and invest. And ultimately, the need for us to have some better systems and processes in place for impact and needs assessments. We actually know what the conditions are on the ground and can therefore design recovery work that is actually appropriate for our community needs. In addition to that, I mentioned this before, but how we address systemic inequity is critical to recovery, I think, in Vancouver and elsewhere. And one of the big learnings for us here, especially around response, has been that there's not just basic needs in terms of, food and shelter, that we need to expand our thinking about basic needs and service provision as a city to include things like hygiene, sanitation, and digital access for the place we are in the world right now as a virtually connected world. And then last, again, but certainly not least, strengths and capacities. So our community has demonstrated tremendous resilience over the past year. This has been an incredibly challenging situation for everybody, and people have fostered relationships, moving to kind of digital platforms, People have used outdoor spaces that either existed pre-pandemic or have been set up and established since the pandemic. There are wonderful organizations that are continuing to serve their communities and transform the way that they serve them to meet the needs of the pandemic. And I think more than anything, what we've seen is the criticality of our businesses and our nonprofits as part of our social fabric and community. So they provide critical services day to day, but unfortunately have precarious cash flows. And so as a municipality, if we want our community to be more resilient, we also have to think about that network of businesses and nonprofits and how we can help them to be able to continue their service provision no matter what happens in the future. And also, I think there's been a big learning around not just thinking through kind of the immediate disaster, the immediate crisis and the action that we need to take for that, but also the cascading impacts of the actions that we take. So again, thinking of our provincial health authority mandating the closure of facilities, I don't think it was anticipated at the time that that would have such a critical impact on all of our other services. And so learning from that and recognizing that we probably need to put some plans in place where we're thinking through what the cascade of impacts of those decisions might actually be down the line and over the long term. So I'm also just really excited to say I was invited to this conversation today because I was introduced to Duncan and David a few weeks back. Vancouver has been reading the Manchester briefing for months and months and months, and it's been incredibly inspiring to see the work that's happening in cities all around the world and to be able to learn from that. We were connected with Duncan and David through the Resilient Cities Network, and we were thrilled to find out that there is a recovery ISO that's being developed. And so we have had it on our work plan in Vancouver to create a recovery framework for some number of years and have just not had the time in our small department and team. So this has been a wonderful kind of opportunity for us to work with them, not only to kind of share our own lessons learned from the past year, our own experiences in the Canadian context, but also to be able to work with them on creating a tailored recovery framework for Vancouver, which includes things like communications and engagement strategies and impacts and needs assessments. So we're really looking forward to that work, and we're really looking forward to making sure that Vancouver's recovery framework in the future really centers resilience, health, and equity. Yeah, so thank you so much for having me here. I'm really excited about the projects that we're going to be working on, and I look forward to any comments or questions.
Thank you all, Duncan, Piero, Katja, and Louis, for excellent presentations from 4 places around the world, which I think was good. And there are a few questions. I will read them to save time, but while we go through the questions, I would like to end our whole session with a few things I like the speakers to comment upon at the end. And I have 2-3 questions which I like you to think about when we answer the other questions. First of all, Biden has said, build back better. And that's also a United Nations statement. And I would like you all to think about, because I don't think we come back to what we were before, at least for some time. So what 3 main things do you think will change, will be in a different way when we recover? The second thing I like you to address is the vaccination certificates and the problematic around this. I miss traveling. Before this happened, I traveled about 100 days a year around the world to my chapters, participating in conferences, and I haven't been traveled since February last year. However, when we have the certificates, there might be that this create other problems. And for those who are not vaccinated, what do you think will happen in these settings? And the third one, in Norway, we have been very concerned with the young people. I don't think it was mentioned, it was Vancouver mentioned a lot about the elder generation, but we feel with the home schools, I have a son myself of 15, and he has at home school at the moment. So they have canceled the examination on the written examination. They will have an oral examination. What kind of impact does this have? 3 questions I'd like you to answer at the end, but then I go to the chat and we can start with the question raised. Let me go to the top. We have one from Daria Wooderspoon to Duncan. Has any work been done specifically looking at emergency services impact, response and recovery? And if not, are there any plans to do so? Thank you for the presentation, very informative. Duncan.
Thank you, Harold. Yeah, there's been lots of work being done on all aspects of the response, and there's been groups set up by the National Police Chiefs Council, by the National Fire Chiefs Council. Some of those groups are joined, so they're joined at UK national levels and within Home Office in the UK. And David Powell and I have been participating in many of those groups and trying to bring some of the lessons. Those groups have commissioned us to do certain pieces of work, but trying to bring lessons from overseas as to what experiences have other emergency services had and how have they dealt with them? So specifically around policing, for example, how have police managed to police the lockdown while still trying to encourage people to respond rather to enforce a law? So there's been lots of lessons that have been learned, and those are going to continue to be learned into the coming period, and we're constantly learning. Obviously, some of the scenes that we've seen in London over the last few weeks with regards to demonstrations and have been commented on by politicians and by the Met Chief Commissioner. And those have been commented on as being disappointing, or various other adjectives have been used. These will form part of a national response, a national time for reflection and time for assessment through parliamentary committees and the like. And so that lessons will constantly be learned and will constantly feed into the ongoing response and into the recovery. And I expect that we'll see some changes as to how things will happen and how practices will continue going forward. And hopefully some of the experiences that we're having in the UK will be used by other countries to learn how they should do it and how they might not do it.
Thank you, Duncan. There is another one for you, and please, all you speakers, read and prepare to be ready when I call on you. The second for you, Duncan, is looking forward and within the context of your presentation. To what extent do you see a genuine and meaningful need to test and evaluate national or regional flu pandemic plans, response and recovery beyond national boundaries, given the clear implication on how the pandemic impacts on political, economic, and wider social issues? Please, Duncan.
Yeah, I think that's what we've done over the last year. We have tested those plans, but not in an exercise, in a real life experience. Those plans in many cases have been found to be wanting. And so I agree with the question as to whether these should be exercised internationally. We have obviously exercise Cygnus in the UK. That was an exercise that was run on pandemics. And not just do we need to run exercises, but we need to learn the lessons from those. We need to take those exercises extremely seriously, and we need to, more importantly, take the lessons from those and embed them into what it is that we do. But recognizing that the response to the pandemic has not necessarily been only an international one, it has been a local one much more than it has been an international response. So we see international lessons, yes, but we see actual activity happening on the ground. It's our communities in our streets, in our neighbourhoods that have been responding much more than I think people often give them credit for. We have seen local authorities doing things that have been unthinkable and absolutely extraordinary to watch, and huge compliment to the local authorities and the ways in which that they have dealt with many of the expectations that have been put on them at very, very short notice. Things that perhaps we can plan for, but actually the agility of those organisations to respond has just been absolutely extraordinary. But our communities have been at the heart of our response, and we have been talking about something called local resilience capability, a way of trying to create a capability in our communities that is a community resilience capability. So it's a way of operationalizing community resilience. And we see that that is one of the big opportunities that comes out of COVID, is how do we make our and encourage our communities to be at the heart of responses to events like this, as well as to the heart of other responses. So responses about mental health, responses about schooling, responses about some of the other questions that you've posed to us, Harold, is where can communities really have a deep impact on that, and creating a local resilience capability to enable that to happen. Thank you.
Thank you. I have a question from Tony, but I think he didn't put it all. So what do you comment? Why do the comments include UK and Manchester? I'm not sure, but the next thing he said is something about EC. I'm not sure when leaving EC and preparing for not being dependent on EC. Have you any comments on that? Well, he asked everyone, but I believe Brexit is an UK thing. Can you see? I'm not sure what he means about this. Maybe Tony can. Okay, try, Duncan.
No, sorry, Harold, I thought you were directing it to me. I'm keen. I don't hog all of the speaker opportunities, but I think that that at the moment we're looking at how do we reimagine our economy. High streets have been closed. Businesses and supply chains have been disrupted hugely, and I think that all the opportunities and all of the challenges that the Brexit poses need to be considered in recovery and renewal planning.
Okay, if Tony hasn't been answered properly, please post a new question. And there is one now for Louis, and this is about there was something in the photo and you have answered it here, but can you explain a little bit about the passport debate and the sticker you presented, Louis?
Yes, Errol. Yeah, the sticker is more informative questions of the passport. We put that sticker on the public space just to deliver information to the public about the closed equipment or not allowed to circulate in specific region of the city. So it's not a passport. For example, the question that Duncan's put, I think is very interesting. We are trying just to have a discussion at the national level just to understand the passport, how that will work in the future, but it's not a passport, just the informative question where we put the sign just to pay attention. I think it's a very interesting merchandising just to inform the people, it's not a passport.
Okay, thank you. And here is one to everyone. So why don't we start with Piero and then Katja answer, how do you feel about the security aspects regarding the potential terrorist drive by attacks, RF putting more people outside in the streets? Can we start with you, Piero? You comment on that?
What to answer it in the sense that people live on the street, people live in public space, and we cannot be worried. We need to take care that we need to control that it's going to happen, but I can't see any other option I can't keep the people. We cannot keep the people in the house after a year of lockdown because the contradiction after it. There is a risk. We need to increase our capacity to monitor in the street, to monitor, to track the terrorists, the potential terrorism threat will be done. But we have strong secret services and police that are in charge of this and so on. And I think that also the people are the one that should be the first controller of the public space of things. So I think it's among us. And actually, the first thing to avoid terrorists is to stop politicians fighting about religious issues on the others. Because more we are democratic and more we are polite in the public speech, less attack we will be. That is the first. That is maybe my answer. It's not about the space. It's about the politeness of the politicians.
Thank you. What about you, Katja? Would you like to say something about that? Katja, do we have you with us? Okay.
I think she had to leave, Harold, for another meeting.
Oh, did she leave for another one? Okay. What about Duncan and Louis? You like to comment upon this question about security aspects? Louis.
Yes, Harold. I think for us, the security aspects, for example, the risk of terrorist attack in Portugal is very low. Is something that we don't have high level or high risk in our country. So I think internally and externally, Portugal don't have, I think, the image or the dimension that UK or Italy has. So for us, it's not a big issue, the security aspect. However, I think I agree with Piero. For example, it was very hard for us to put people in the house during the lockdown. We have great weather. We have people that have a mentality to live in the street, to enjoy the public space. So it was very hard. So, however, the security aspects for us is not a big issue when we try to just take a look on the terrorist attacks. So for us, I think it's not a big question, just to take an overview for the next month.
Duncan, you had some attacks in London before the pandemic. What are your thoughts on this?
Absolutely, we did. But I think that I really liked Piero's answer, which is, we need to enjoy the freedom that these spaces offer us. And as we come out of lockdown, we're still in lockdown in the UK. As we come out of that lockdown, people are going to be wanting to meet each other, and those spaces offer excellent opportunity for that. So we need to think about how to use those spaces in a safe way and to provide people with a really good quality of life.
Yeah, we have another question really related to this, and it says, could you describe any research that you are doing to address the effects on the pandemic on the tourist economy? Because we don't travel anymore, or what happens in Norway now, everybody tried to travel during Easter, but they were stopped. So what do you think about this? This is about the same, actually. We can start with you, Duncan.
Well, we're actually doing some work in Bath and perhaps in Palestine around this. And so I'd be really keen on hearing what Milan and Amadora are actually doing, because obviously they will both have a huge number of tourists coming in. So maybe I'll just hand the question over to say, I really like the question, and it strikes a lot to the work that we're doing.
Thank you, Piero.
About tourist travel and economy, well, we are still in the lockdown until after Easter time. So as you said, we need to stop. There will be more flexibility to rejoin family compared to the last year, because at least they also need to come back to family. It's necessary. But I believe what we are doing, working for the tourism at the moment, it's first of all is to guarantee to students to travel and to come and to join and to keep their life in the city, because they are an important piece of traveling and moving. They also be attractive for tourism. So one of the driver. The second one, it's we believe that for the next few months there will be still some limitation, like UK has introduced for traveling even over the summer, and And we believe that the local tourism, renaissance of the Italian and local tourism has to be the driver in somehow. Because sometimes over the last 10 years, due to the globalization, we prefer to travel, I don't know, let me say, we go to the Caribbean to find a wonderful sea. And then you go to Sardinia, you find the Caribbean inside in Italy somehow. So for a while, it's focusing on local tourism, on Italian tourism. That has to be the things we have to do. For a country like us, that we have a certain number of population, as well, size of population. And I think UK could be similar. Maybe they don't have the sun. That is the issue of what. I don't know, Luis, what you.
Louis, what you say? Portugal is a very nice destination for Scandinavian tourists.
Yeah, I know.
we like the sun.
Yeah, I know that. I think Portugal, I think based their economy on tourism. So I think it was a big problem for us. So the impact on tourism, I think, is huge. We have closed the hotels. We have very low traffic in the airports. So as I know, I think the national government are trying just to work on the some funds and some support to this sector specifically, because without tourism, I think this is related with economy. For example, Amadora belonged to the Lisbon area, so we felt a lot of impact because we didn't see tourists, just some students about Erasmus that, well, they came here during after the summer. So, but the impact was huge, and as I know, I think I don't know if we have some research study, because the question is about that, about the research. What we are doing specifically, I know that the national government are working on this and will deliver, I think, as soon as possible, some package about funds to support tourism. Otherwise, I think the summer will be very, very dark for us.
Yeah, okay. We have another one which should be addressed to Piero. And that is, so what I opened with, public participation, governance of including the citizens in the communication. This was something we addressed in Asset. I was found very valuable. How do you include the public in the communication, not an one-way communication only? Can you like to see if you have any plans for that in Milan?
Well, we have, since before, we had an online platform I've been creating to have a comment or review in our major plan, but at the same time also major reviewing consultation process on strategic policy. And it is not a top-down or one way, it's a bidirectional activities. In the meantime, we are closing the house, close in our office and so on. So I believe that the participatory process is something essential for us in general, because the community, as I said, they don't like the top-down things, so they want to participate. So we love to online. We got in September, we were capable to organize really, really few events with few people. With the name was Fare Milano, so it's doing Milano, let's say, in English. And because as soon as we got the opportunity to reopen and to get in contact with offline at the stage, but go for live, we have made it for a few days. So it's always a balance. It's not one direction, it's a bidirectional. And if I can keep, because I need also to leave, because I'm joining another.
Okay.
Can I maybe answer to your free question, because it was a challenging one?
Good, we end with that.
Let me start from the passport. I'm against the passport personally. The passport is going to create inequality. It's create conflict. It posed the condition that the people say why they come first and then they come second. And the decision why supposed to be the first one, except for the vulnerable population, or just the other categories, that will never satisfy anyone. Then the second one is, if you create differences in the vaccine in a free market with a capitalist market, so you should create as well condition for the private to get paid for the vaccine. Otherwise, it's just a top down with some categories that will be some privilege before the others. I think that as we suffer all together over this year, we need to wait all together. So I'm also understanding, Luis, about the tourism somehow for them. But I think we need to rebalance and redefine our way of living for another 6 months before start traveling again, because then it's what is necessary. Also, vaccine has to be guaranteed to everyone first, and then we can get there. And the otherwise, I think the passport vaccine, if you go for the passport vaccine, so open to the private to get paid, but when the one is paying for his vaccine, they can donor the other vaccine that is for free, maybe for the country, to the low income or to the developing world. Because we are always thinking about Norway, Italy, UK. But what about all the African country, the South Asian country? So why we should penalize already someone that is already failing? Looking at the, I can't remember the second question, but I remember the first one.
It's about change. Well, we will have permanent changes. The society will change. Three main things.
The society will change. One will be changing the space, in the housing space and the working space will be redefined, and we need to adapt our building because we will have a different kind of life. We already seen we have more requests for balcony and roof, for example, already in the things, and that is one. The second one, I hope, will be a changing, and is a positive one. I think one is the care, to take care of our planet in a different way, in the natural resources, because we have seen that if we do it, it's possible to reduce the pollution. It's possible to keep the people in a different way of living. There was force, but I think we can do it because we see that it is possible. Third one is timing. So it's timing. So timing in terms will be changing is the time of our life. I think we have understand that we go from a kind of time, then we got into this Zoom life or Teams life that is taking out all of our time. So we will define also the time of our life as people, as population and community. So it's time, care, and space. I think there will be three main challenges we will say in the city, at the global scale, in my opinion. That's it. I hope
thank you, Piero, and you may leave. I will ask Louis and Duncan to follow up, answer my questions.
Thank you very much, all of you. Ciao.
Thank you.
Bye.
Bye.
Louis, can you address my three questions?
Well, I think about passport, I agree, subscribe what Piero said. I think it was perfect because I think I'm the same opinion. I think the passport, I don't know if, for example, the national government will create that, because I think it's more something that the European Union just wants to discuss, because the opinion of the national government is not to have a passport. So I think that's one point. And I agree that there will be a problem with the passport, because if I have vaccinated, I could move around Europe. If the people don't have the vaccine, can move around Europe. So that maybe creates some inequality behind the people. About the change, I think the society will change. I think, for example, we felt during this year of pandemic situation in Amadora, we thought that the people are trying to be more resilient, trying just to have more capacity to absorb the impacts. The people has been 3 times in lockdown, so I think they now, we felt that the people are more contact with nature, for example. People enjoy more the public space after the lockdown, so maybe it could be a switch of the behaviors of the people in the next time. I think the third question was about the schools, isn't it?
Yeah, about the young people.
For example, I have 2 kids, so it was very hard for me just to keep them at home. They had some school sessions in Zoom. Was very hard, because that means that we have to be parents at home just to support them, to have schools. And the quality of the teach at home is completely different. So the impact was huge. The first thing that the government opened was the schools, and I think was the right choice, because they have the kids at home just to try to pay attention on the computer with 2 hours in sessions was very hard. So I'm not a big supporter of the schools and teaching at home. So I'm more the presential sessions. I think is more useful than if you compare with the at home.
Thank you, Louis. And Duncan, do the last one.
Thank you. So I think everything's been said on the vaccine certificates, and I agree with Piero and Luis on that. In terms of the Build Back Better, what don't we want to go back to? I think there are so many things that I don't want to go back to. I'm quite happy with change. I'm quite happy looking forward rather than looking back and looking at the world as it used to be. I think many people on this call will be probably not the people, actually let me start again. Many of the people in this call will have enough food, will have internet connection, will feel safe where they live, and will have a home in which to live. And in some of the meetings I think that we've all been in, we've understood that the number of people for whom all of those conditions exist are much less than I previously thought. There are many, many more people who are hungry, who don't have a safe place, who don't have homes, and internet connection is probably one of the least things that they're bothered about. So it's for them that we need to change. We need to address some of these inequalities, not only global inequalities, but the inequalities we see on our very doorsteps. And we need to understand more about these inequalities and deal with it. So Piero talks about care of the planet, absolutely, care of the people as well. In terms of the young people, yeah, we've seen a change to schooling. And I think that many schools have struggled with that hugely. And that has been to the detriment of our children. And many families have tried to overcome that. I don't mean only immediate parents, grandparents have been doing classes over Zoom. We've seen a whole community response to trying to help our children. And we must never take their eye off of that, because they have been affected in ways that we still don't yet understand.
Thank you, Duncan. There are still some questions, but please, you can go there and answer them there. I see there was someone from me. There is also one for the organizer. They ask about a certificate that goes to the organizer. See if you will issue that to the participants. And I think it's not more to add, but we are running over time. I have another meeting. So if you have anything to add, Louis and Duncan, please do.
Just on behalf of our team, I would like to thank the speakers and to thank the Abby and Becky for helping us with organising this. I'd also like to do a call out for the next webinar. So this is the first in a series. Details are on your screen. You'll be very welcome to sign up. But here we're going to be talking about communities. We're going to be looking at what this new local resilience capability is, what it means, how can we ensure that our communities are better served. And so we'll be talking about that in the next webinar. But thank you, Harold, very, very much for organising this discussion for us.
Thank you. Yeah, I think we by this say, and if there is any unanswered questions, so we try to do afterwards. Thank you all, and we close this and welcome back to the webinars. Teams also have webinars, and I will also send out so you can join. We have a little bit different focus, but we will also have Duncan and David to come to our webinar and tell more about COVID-19 issues. Thank you all. Have a good afternoon, and I see you again. Bye.
Bye. Thank you.